My name is Tim Ria, host of Digital Health Live here at the Digital Health Summer Summit in beautiful San Francisco. Really excited to have my next guest here today is Danielle Ruppar, who is the Global Research Director of Connected Healthcare Life Sciences for Frost & Sullivan. How are you doing?
I'm great, Tim. How are you?
Good, good. So where'd you come in from?
I came in here from San Antonio, Texas for the conference here at Digital Health Summit.
So you have an interesting background. How did you get started in the whole digital health space and to get your expertise?
Sure. So I've been working over a long time in healthcare and sort of have progressed out of what my background was in pharmaceuticals in terms of other areas that are around the use of information technology in healthcare. So health IT, telehealth, remote patient monitoring. These are more my areas of focus now and have probably been for the last couple of years. And I really tried to help our analyst team at Frost & Sullivan develop our business in this area as well.
So Jill Gilbert pulled you in because you have, in essence, a crystal ball to look at the top markets, the emerging opportunities in digital health. So we're going to basically do a quick rundown of the hot spaces. Either you're an investor looking at placing some bets or an entrepreneur looking to create new opportunities.
Yeah, so that's an interesting question and really is totally relevant to the digital health conference here. Remote patient monitoring is really a hot area of interest, but it's not really that large of an area right now, but is a large area for growth opportunity. And there's a lot of reasons for that, especially within the focus on readmission prevention here in the United States over the next couple of years, as well as...
When does that launch?
2014, 15, and a lot of also in terms of helping people manage chronic diseases better. So there's a lot of vendor focus, a lot of provider focus in this area right now. How do you use video telemedicine? So this is something that's sort of nascent, that people have a lot of services, but hopefully what it will be is someday you can actually do this right now, but it'll be more commonplace where rather than going to your primary care physician, you would be able to do that in your home. You actually can do this right now, but just to me, it needs to progress some more in terms of that being more common for people being comfortable with that type of virtual visit, right? We see a lot of interest in, I talked about the wearable space. It's an area of hype right now. But what does that mean from a market standpoint? A lot of companies are really struggling with this. There's all sorts of startups to major players launching devices in this area.
It was like $100 million to create a wearables device. Nike pulled out kind of in a way, or they're making space for Apple, or...
Yeah, there's a lot of different changes in the market. I mean, even if it could be pretty disrupted if somebody like Apple were to launch a hard device. I mean, Samsung's in the market. They've not really disrupted the space with their device, but I think there's more opportunity here in the U.S. for somebody like Apple to do such a thing. Yeah.
What's next?
Sure. What's next is from our work at Frost, we're really trying to help progress out in helping our clients understand more global opportunities in these areas of digital health. Yeah.
Curious, like in the BRIC countries, Africa especially as well. Like, what is going on, especially in countries where they're leapfrogging computers going right to mobile devices. We're approaching 5 billion mobile devices. What's happening?
Yeah, that's definitely the case. In certain areas are leapfrogging versus more what being traditional LAN types of connections, of course, because of the proliferation of smartphones in all these emerging markets. But in some regard to what we talked about here in formal remote patient monitoring or other types of things, they're behind what we hear are in the United States. And the U.S. is still, North America is one of the more leading areas of adoption and will be in the near term for a lot of these technology solutions. Not that they aren't heavily leveraged in the emerging markets, they definitely are, especially places like that don't have infrastructure and are fully reliant on mobile, like Africa or other regions like India, et cetera.
So, how do people actually leverage Frost & Sullivan?
Sure. So we help our clients in a lot of different ways, really trying to understand and solve business problems. And what that means is trying to not only get information, but answers or help them with strategy to grow their businesses. And we talk a lot about opportunities for our clients around new opportunities for innovation. And a lot of that's because of how industries are converging. I mean, the digital health space really, to me, is a convergence opportunity between healthcare and the information communication technology space. So this is a lot of what we help our clients on at Frost & Sullivan.
What do you see coming up for, say, CES 2015 this year, the next 6 months, 9 months?
Sure. So that's an interesting question. I would hope to sort of see some progression of the merging of the more mobile smartphone area with the wearable space directly. I think you start to see other things that are not about something you're wearing on your wrist. I really want to see larger progression in that sort of clothing embedded incorporation of sensor technology or other things. How can that be used? Will people actually want to wear them? And sort of, I think there's a lot of progression out there from that standpoint. I think you'll see a lot of companies that were at CES last time and some areas of the digital health pavilion that probably won't be there this time. There was a lot of startups there trying to launch similar products with similar price points. Some of those won't be able even probably to launch or won't be around next year.
It seems like right now, too, with Apple, with Samsung, with Google, they seem like vortexes that just want to eat all information. Now they want to know all the data about your body. Do you see a pushback with the customers, the consumer population, when that's happening or not?
No, not really. I think the consumers, if they're more acceptance of those brands, could be fine with that. I mean, because they're more trusted and it's something already incorporated into their daily life in some regard as well. And so that's why I think once Apple launches their health kit application, it'll be interesting to watch. Does that actually make a difference in the market or not? If it does, then that could tell us something in terms of consumer acceptance of it from a brand perspective that maybe could be leveraged by other people who are trying to enter the space out there in a similar position.
So how do people tune into your channels? Because you got some interesting information flowing. How do we tap into your flow?
Sure. So you can follow me on Twitter, which is at Daniel Ruppar, or you can also look us up at Frost and Sullivan at connectedhealth.frost.com.
So that's DANIELRUPPAR on Twitter.
Yes.
All right, Danielle, thanks so much. Very insightful, and thanks for your time.
Awesome. Thanks, Tim, so much.